So if people who are on the panel would please come on up. On the panel are, again, Tom Patterson, who'll be chair, and I'll introduce him quickly. And then Lisa Eyler, who does marvelous work. Mariana Cherner, who you've heard her name, and marvelous work. And David Moore, who, if I remember correctly, was on several of Chris Hakim's slides. To introduce the panel chair, Tom Patterson is a distinguished professor of psychiatry. He does research on measures of functioning in cognitive impaired individuals and interventions in individuals with HIV high risk. But as I often do, I wanted to bring up one of my favorites. You came to us with, I think, your PhD in bird songs, or what? And honestly, as a bird lover, and indeed how intricate they are and how fascinating that work might have been. Well, enough of that. Let me turn it over to you. Okay, thanks.
Actually, in that vein, I'll say that I actually started off in primatology. And so I studied non-human primates, and then I started studying birds, then I started studying fish, and finally down the phylogenetic scale to people. So I came here actually in 1980. It's been a while. And with that training, you might think, how did I manage to succeed? Well, the talks that you've just heard really do characterize the reason that I was able to succeed. People like Dilip and Igor, Hamp, in fact, pretty much everybody in this department, even people I haven't directly worked with, really influenced my thinking. And so I can't thank you enough for all of the help everyone here has given me. I am a almost distinguished professor, almost extinguished professor of psychiatry, cognitively intact, I hope. But I found these talks really fascinating and, as always, stimulate thinking in new ideas. Dilip was really very, I'm going to be very brief because I want everybody to have a chance to talk, and I want the audience to have a chance to really ask questions too. We seem to be short on that in our other sessions. So I'll just say that Dilip was very humble and not really talking much about the origins of his work and how much influence he had on geropsychiatry, and really extending how we think about schizophrenia and identifying late onset schizophrenia as really pivotal. And it's just remarkable how innovative he is. I guess it's a sign of my lack of wisdom that I didn't follow him in the study of wisdom, because clearly that's just been an incredibly productive area. And it really does point to what we normally forget. And I think you've emphasized that. Usually our studies do focus on the negative. Dilip has pointed out that there are a lot of positives. And I think that's really critical. What I saw from Bob was a real short example of how much he's really contributed to neuropsychology. If you have a question about neuropsych, you go to Bob, and you're going to get the answer. Definitive, for sure. And it's really remarkable how much pioneering work he's done in the context of the HNRC, HNRP now. And it really demonstrates the length of time and the depth of studies that have gone on at the HNRC. Chris's work really starts to drill down and shows the breadth, and that's only a small sample of how much real detail trying to understand neurocognitive problems in HIV. So, I mean, to me, it's just an incredible show. It's not just the amount of funding, it's the level of understanding, it's the depth that's really impressive in that area. Then we get to Beth. And Beth, I mean, I think there were some ideas in there that, for me, as always, when I hear these talks, I start thinking about what could we do with this? I mean, it's really amazing to think this work generalized to a year. Right now, I'm working with a number of people on trying to, including David here, on trying to extend safer sex among sex workers by using text messages. And so we've been working on that for a few years. But it occurred to me that we may have missed the boat. Should have talked to Beth along the way, because I'm not 100% confident that we've chosen the right strategy. We might have really focused on habits and been more successful. I don't know yet whether this has worked, but I think this is a perfect kind of an example of something that could be generalized to a lot of problems, including HIV, sex risk. It's just a remarkable study that you've really started, so I congratulate you on that. So I'll stop there and move to our panel. And this panel is really remarkable in their work, too. We have David Moore, who is, you've seen his name practically in every area. In fact, I believe it was on every single presentation at one place or another as a neuropsychologist. Really fantastic, and I know that his work now in using text messaging and whatnot has really revolutionized that field. So I'm really, it's an amazing. And then we have work on imaging that is just spectacular, trying to meld together all of the, from functioning all the way to brain imaging. I think that's incredible. The work that's is going on down at the HNRC that you're doing with minorities, I think, is really important. It's something that people forget about oftentimes. So that I think that this is a group that really has contributed remarkably to a number of fields, not only HIV but also in severe mental illness. So with that, I'll just ask each of our panelists to make a comment, if they would, please. David, you want to start?
So thank you for the opportunity to be a panelist and to be part of this department. I first wanted to say that actually both Mariana and I were recently at the American Psychological Association for some committee work. And up on the screen was a quote which I actually think much better represents our department than it does the American Psychological Association, which was that culture eats strategy for breakfast. And I think that the culture of our department is such and so collaborative that it has created opportunities for people to collaborate. And so I feel very humbled to be here. I feel very thankful to have worked with all the people who presented today, and to Bob, Igor, Dilip were my mentors as well. And so I've grown up in this department, and when I go outside of the bubble which represents this department and see how other departments function, you see the culture that is here, and that collaborative culture is really critical. In terms of the talks, I can see how each of the talks dovetails into one another. So there's impressive reach here, which I think we have to constantly remind ourselves. So I'll focus on Bob's talk, but really the Frascati criteria were really led by our group, the HNRP, in collaboration with experts from around the world. And that is really the criteria by which we define HIV-associated neurocognitive disorders, and it's still used. And then to think that those criteria have been applied on that last slide where you see the map across the world, and those criteria we've been able to detect and identify neurocognitive impairment across all these different populations is really amazing. In terms of how that links to the other talks, I think Dilip mentioned, but we're looking at successful aging among people living with HIV now, and really trying to focus and find those positive factors that people can build on. I think there are open questions about the overlap in people aging with HIV, and Chris mentioned some of those, but really how do we disentangle people who may actually end up having Alzheimer's disease as well as HIV infection, and how do we determine those people who would have had Alzheimer's disease regardless of whether they became HIV positive or not. So I think that there's open questions and challenges there that we need to figure out. And lastly, I think Beth's work, it's really impressive how the laundry list of conditions and disorders in which she's covered, and I think trying to figure out how we can apply those to any of our populations with whom we work. And then at this point, I'm going to stop there and pass it over to Lisa.
That was a great start, Dave. Thank you. I agree that I think the culture here is great. And one of the things that I've been impressed with as a clinical psychologist coming into this department of psychiatry is really the breadth and the scope of the scale of the types of investigations and how comfortable it is working with all our different colleagues at different levels of analysis. And so it's been my pleasure to work with all of the people that presented today, and I think we really demonstrated how the approach to cognition and to aging can be done at so many different levels of analysis. Dilip ended his talk talking about societal wisdom, right? So that's even way expanding beyond sort of the mental health of individuals to the mental health of our world and our society. And it's been great being part of the Center for Healthy Aging, where we can have these discussions with people from all over the campus and see how psychiatry and our focus on the mental health and well-being of individuals can expand to get to the mental health of our society, which I think is a great way to look at these things. And I think that on the other end of the things is how great of basic neuroscience we have going on in this department on the topic of aging and in serious mental illness, as well as in HIV. And I think Chris's talk really showed how if you dive down and look directly at the brain, either with PET imaging or with neuropathology, you can start to understand what are those underlying biological mechanisms. And so I think what was great about this combination of talks is the way that you can see those links and the way that people are working at the boundaries and at the translation. And the fact that we're so collaborative is what allows us to do this translation, so that things that we learn about the brain, as Beth showed in one of her slides, can help to form how can we better improve these interventions. Things that we learn about the brain in terms of wisdom can help us to understand that concept, and maybe help us to figure out how we can improve societal wisdom. The neuropsychology and how the cognitive domains that are affected, how that interacts with the actual neuropathology is really important. And the final thing that I would say is something that I've been increasingly interested in, and Dilip has as well, is the idea of disorders of mental health and sort of brain disorders as whole body disorders. And I think that was another thing that Chris did really well, is emphasize the role of inflammation and how things that are happening in the whole body are also affecting the brain, and we should not only expand out from the individual, but also within the individual expand down from the brain to the rest of the body.
Nice. I have to, being last in the panel, I can only echo some of the excellent thoughts that you folks have put together. I'm really gratified to be here as part of a 50th anniversary. 20 of those years I've spent here. Grew up in this department like Beth and David. I've spent all of my career here, so this is the only model I know, but I think it's an excellent model of translation and multidisciplinary focus within a psychiatry department. So I grew up at the HNRC, or now HNRP, and had the great luck to have Igor and Bob as mentors, and learned sort of the importance of having interdisciplinary focuses, not focus, but focuses, people from lots of different points of view coming together to solve critical and important problems that can't be done within silos. And what was really nice about having this combination of talks, it probably wasn't accidental, is that when I started in HIV research, you didn't even conceive of aging as being a part of that research because people didn't live to old age. And now it's, I think, just expected that everybody will get to a ripe old age and that we have to deal with these two sets of morbidities and how they might interact. So I think we've come a long way scientifically, but in large part it's had to do with people from multiple disciplines trying to understand these brain disorders and physical disorders. And then I was really gratified to see the positive aspect of what we do with Dilip's work and Beth's work, which is we're often the bearer of bad news, and in the work that you showed, we actually can be optimistic about some of the good parts, not only of aging, but also of, how do you help people with some strategies that you think would be common sense, but in fact are not, and can really help. And I was very impressed, Beth, I was asked to focus on your presentation about the breadth and the number of different disorders that you've been able to apply your work to and how successful you've been in that. And I think it's wonderful. And well, maybe I'll stop there and see if the audience has some shadows and
I'm just
questions.
here to bring the microphone to people.
Good.
Because some people have trouble moving out of the road, and I want to be sure they can talk.
Thank you. Just one thing I would like to just add, and that is, I really like the slide that showed all of the countries, the things that are going on, all of the research. Just as a reminder, we in the United States are very fortunate, and that, that it has become the norm to have viral suppression. That's not true globally. So you really need to study. Anyway, let's go to the audience. I'll let Mark guide the places where the mic goes.
Okay, go ahead. No, thank you. I was struck by studies coming out of Myrna Weissman's group and JAMA Psychiatry recently. First, I think I'd direct this to Dilip, that parents who rated spirituality as important to them, which over 20 years was associated with increased measures of white matter connectivity in the brain, reduced their risk of suicide in their offspring by 90%, which is pretty remarkable. And this issue came up, Ruth Benka was the chair at Irvine now, was talking on suicidality at the recent Center for Circadian Biology meeting, and thought that might be mediated through sleep, that helps to structure their life. And speaking of sleep, I also wondered that there's now data that sleep disturbances can accelerate the accumulation of tau in dementia patients, and I'm wondering if that's also true. Address this part to Bob Heaton in HIV related.
Thank you, Barbara, for a very important question. There are a lot of data now on spirituality, and spirituality is often included as a component of wisdom. Number of studies showing that spirituality, which is different from religiosity. Religion is an organized system following specific tenets, whereas spirituality is broad. It's just really believing in something that is cosmic, etc. So a number of studies have shown that spirituality is associated with not only better mental health, better physical health, and possibly even greater longevity. So I think the study you mentioned is very important because that shows you're talking about wisdom and its role in education. The education starts with parents and what the parents do. So and in a way, if you think about that, when we raise the kids, what do? We teach them to control their emotions. We teach them to be empathic toward their siblings and others. We teach them to self-reflect. So in a way, the parents are teaching our kids about how to be wise. And spirituality, I think, is an important component of that. So I really like that kind of work.
It's true that we've been focusing a lot on the negative aspects of HIV disease, and we are right now planning to move towards the next iteration of the HNRC, and we're really focusing a lot more on mental health issues. And we're finding that there's a sizable group of HIV-infected people who are not showing significant depressive symptoms, and their overall quality of life is just as good as the HIV negative controls. And we need to and the depression in the others is associated with lots of disease-related problems and cognitive problems and so on. So we need to drill down, especially and look at this in a longitudinal way about people who change in terms of their symptoms, their depressive symptoms, and what might that affect in a positive way, and ultimately, how can we help people with this? We know that there are a lot of people who have untreated depression that has been ignored by the system, and we need to pay attention to that. And so that's one of the places where we're going, and we're starting to spend. One of the problems we have, we look at so many things, neuromedical, neuropsychological, everyday functioning, and so on, and we haven't really in the past looked enough at resilience, wisdom, and what this does for people and their long-term outcomes. So I don't know if that answers your question at all, but these are important things.
Igor, do you have a comment?
Yeah, so first of all, wonderful presentations by the speakers, and great discussion by the panel as well. Thank you. And Tom, you are not an extinguished professor, thank God.
Almost.
I don't know if people are aware what he was referring to, but Tom Patterson is a phoenix who has risen after a dreadful, dreadful illness, and we're so delighted that you are here on your game with good wit and all those things. So I have two questions. One is actually, maybe Chris could think about this, Chris Hakeem and the others to Beth, and they're completely unrelated, as I say. To Chris, I'm just wondering what you think of that business of THC's possible protective role in preventing intracellular amyloid deposition. And you can see this is our effort to bring all streams of thought together. Everything converges now, not on HIV, but on marijuana, of course, which is the most important topic in the universe. So, but seriously, there's been a little bit of evidence, hasn't there, that this protein mismanagement may be prevented, corrected by THC?
Yes, actually, and by the way, we did not choreograph this question and answer, because actually we are working on this as we speak. There are two lines of research that we are following. One is how THC and CBD actually may modulate macrophage, brain macrophage phenotype. So macrophage is being important in clearing amyloid. So we have work ongoing in the lab looking at THC, CBD, and synthetic ligands like WIN and other ligands that bind to CB receptors. So that's one line of research. The other one is something that I didn't talk about, didn't have time, but it's close to my heart, looking at chaperone proteins inside the cell, immunophilins, which are chaperones that have aromatase activity, unfold, misfolded proteins. They are involved in axonal transport, and they were described first as receptors for immunosuppressive drugs, but they are very, very important. And we are looking at the effects of THC, CBD on this family of proteins that are also involved in resilience. We didn't get a chance to talk about resilience. That's important for everything, not only HIV, but for aging and what Dilip mentioned. There's some work that actually started in collaboration with Dilip's group with Vicky Risbro and Jared Young to look at some resilience in an animal model in terms of cognitive function. And again, CBD and THC may impact on the function of these chaperone proteins that chaperone glucocorticoid receptor from the membrane to the cell, controlling transcription factors downstream. Anyways, I get into much details here. So the long answer to a short question is yes. It's very likely that both THC and CBD have a positive impact on neuronal homeostasis, but not only neuronal, but glial too.
Thank you, Chris. We're kind of running out of time here, and so we've got one individual here. If you could make it a brief
I had a
question.
question too. I don't know if I'm
Oh.
allowed. This is Beth. Thank you for your great talk. Being as old as I am, of course, when we sat in university lectures or medical school lectures, we dutifully wrote down all the pearls of wisdom that our professors announced. I'm sure Dilip will join me in this exercise when you were a medical student. Now, of course, not only is it difficult for people even to pay attention, but when they do pay attention, they may be typing something or whatever. Do you have any thoughts? And by the way, I've also learned as being a grandparent that one of my grandsons isn't even learning cursive. I guess that's passé. But the other, who's in a more traditional school, is actually developing that. Is there any research or any evidence about the actual writing and so forth as an aid to encoding the depth of memory?
He has it right there.
Sorry, Tom, this is such a long question.
That's
but,
okay. We're going to make this a brief answer,
Yeah,
please.
very brief. So yeah, I don't do this work, but I have read about it, and actually writing pen to paper tends to produce better learning and memory effects than typing.
Very good. Thank you.